Iron infusions are considered a consensus first-line treatment for restless leg syndrome for those with low or even low normal iron levels. So why is it so hard to get one? I'm Dr. Andy Burkowski of ReLACS Health, and today's topic is barriers to getting an iron infusion for those with restless leg syndrome. I'm going to give you 8 good reasons why this might be the case. First of all is lack of understanding of iron levels. When someone gets iron levels for restless leg syndrome, the report they get might have these reference ranges, but the reference ranges might be based on population percentiles, like what the community has in terms of iron levels. So even though iron deficiency might be set to 40 for the average person, the reference range may say 10 is the lower end of normal because most people in that population are deficient. So if somebody looks at their iron level, they might not realize that their iron levels are low. And that's sort of 1A, but 1B is that we're looking at the blood levels of iron when we're doing a blood test, but in restless leg syndrome, the brain levels are low. So in terms of ferritin and transferrin saturation, we want to see much higher iron levels in the blood because the brain levels are already low to begin with. And that could be on the order of a ferritin of 75 or 100. And even people sometimes may benefit up to a ferritin of 150 or more because it really doesn't reflect the levels of iron in the brain. Number 2 is lack of insurance coverage. At this point, very few third-party payers actually pay for iron infusions for restless leg syndrome. Most people who are getting insurance coverage are getting it under a different diagnosis, such as iron deficiency anemia or some type of other iron deficiency, whether it's due to chronic kidney disease or other conditions. And the lack of insurance coverage is a barrier to a lot of patients being able to afford this type of treatment. Number 3 is that iron infusion is not a prescription drug. So a doctor who orders iron infusion has to have privileges at the infusion center. So a primary care physician, for example, even if they're in a system within an infusion center, might not have privileges to order an infusion. And the primary care doctor might have to refer to a blood doctor or a hematologist to get that infusion. So it's not as easy as sending in an electronic prescription and getting it filled at the pharmacy. Number 4 is there are a lack of independent infusion centers out there. Most are now based out of hospital centers where you do need privileges, and it's very hard for doctors outside of the networks of their patients to actually access the ordering of infusions. Number 5, even if you can find an independent infusion center, many refuse to offer iron infusions at all because they don't make enough money. Most of them are going to be insurance-based, and if insurance doesn't pay enough for the infusion, they actually may not offer the infusion. They may offer iron as part of a separate infusion with another treatment for a different condition that they can make money off of, sort of as a courtesy, like chemotherapy, for example. But sadly, even if they do the infusion, they may lose money on it, so they refuse to offer it. Number 6, there's a lack of price transparency when it comes to iron infusions. Medical centers are typically based on insurance. They have deals with insurance. They charge these inflated rates. The insurance company pays a certain amount. And if a patient just wants to pay cash for an infusion, many centers will not actually offer them a cash payment. They'll have to go through their insurance, even if their insurance doesn't cover it. And they may have to pay that inflated charge. And they're not even going to know what the inflated charge is in advance. So it's very unsettling for patients to potentially pay way too much for something and not know how much they're going to pay. Number 7 is that myths and fears about infusion reactions still persist in the medical field. There was a form of iron called dexferrum that was taken off the market more than a decade ago that rarely caused an anaphylaxis-like reaction. But all of the iron infusions on the market have not been shown to cause any even serious short-term or long-term side effect or reaction. And so because of the fear of a patient having a bad outcome from a reaction, many doctors are afraid or they think that iron infusion is dangerous, and the scientific evidence has not supported such. In some studies, infusion side effects can occur about 10 to 20% of the time. These are almost always minor side effects. Sometimes there could be flushing, chest tightness, muscle or bone aches, maybe some dizziness. Some of that may resolve if the rate of the infusion, how fast the infusion goes in, is slowed down. But most of these resolve after about 24 hours. And again, that's only 10 to 20% of the time. And it really depends on the formulation of iron that's used. But there really are no serious side effects from an iron infusion. But there's a certain myth and legend about that that puts a lot of fear into the minds of a clinician. Number 8 is a lack of understanding of high iron levels. So some clinicians are afraid to give iron infusion because of quote unquote iron overload. Well, if you're checking iron levels and the iron levels are low, there's not going to be iron overload because the iron levels are not going to be high because you're checking the iron levels. They're low. And infusion, when given, will get the levels up to normal or maybe to a slightly high level. But in normal individuals, the body will use up the iron over time and the levels will plummet back to normal or low normal. And in restless legs patients, they may need to get another infusion again at that point. With the exception of a condition like hemochromatosis, patients are not really at risk of having problems with iron overload or very, very high iron levels that keep going and going because you're measuring the iron levels and you're only giving the iron when they're low. There's also some confusion that a high ferritin level might suggest increased risks and high iron, but ferritin does not always reflect iron levels. It can reflect inflammation or ongoing inflammatory conditions within a patient and does not always show what the iron levels are. That's why we also check the transferrin saturation. So these are 8 reasons for barriers to iron infusion, but for those with restless leg syndrome where it's clinically appropriate, both patients and clinicians should be fighting hard to get this valuable treatment to their patients to help with symptoms of restless leg syndrome. As always, this video is for general medical information only, does not constitute the practice of medicine. Decisions on iron infusion and all medical decisions should be made under the guidance of a licensed medical provider. And as always, one of the keys to sleeping well is to relax.